Welcome to the New Grad as a Leader online education module. This online education module is based on our practice support tool, New Graduate as a Leader Practice Guideline, located on our website in the Professional Practice section under Practice Support Tools. In this online education module, we will discuss the NSCN mandate, strategies for success that include communicating and staying connected, knowing your limits and staying within them, adopting a risk management approach, accepting accountability, and asking questions. The module will also review the conditional license restrictions that are applicable when being in the charge nurse role when holding a conditional license. The module will conclude with some key points from the presentation as takeaway messages. The Nova Scotia College of Nursing mandate is to serve and protect the public interest, preserve the integrity of the nursing profession, maintain public confidence in the ability of the nursing profession to regulate itself, and to set and monitor standards for the profession. There are approximately 14,000 nurses registered with NSCN that provide nursing services to Nova Scotians. This includes LPNs, RNs, and NPs. As a newly graduated nurse, there are many new experiences that you will encounter as you begin your career, and as a result, your needs and opportunities will be different from those of experienced nurses. The support of your manager and other colleagues will help you to be successful in any designated role, including the charge nurse role. Supportive practice environments will ease your transition into practice and help support you to provide safe, competent, ethical, and compassionate nursing care to clients. Taking on the charge nurse role requires preparation, including education, mentorship, orientation, and support. The next few slides will provide you with some strategies to help you take on the role of charge nurse when you do not feel prepared and help you transition to being able to work in that capacity. To communicate and stay connected, speak with your manager about your concerns. Let them know how you feel and offer a solution. For example, notify your manager that you do not feel ready to take on the charge nurse role, but with some education, mentorship, orientation, and support, you will be ready to take on the role in the future. Help prepare a plan of action for your success in this role. Speak with colleagues who you have graduated with who have also been asked to take on the role of charge nurse. Inquire about how they have handled this. What education, orientation, or mentorship did they engage in as preparation for the role? What can you learn from their experiences? Know the limits of your practice capability during this period of transition. If you are unsure of the competencies required in the charge nurse role and how you will attain these, discuss this with your manager. You should have a clear description of the charge nurse role which will tell you the competencies required. If you are uncertain about any aspects, discuss these with your manager to clarify any questions or concerns you may have. Adopting a risk management approach involves gradually advancing your skills both clinically and as a charge nurse. This will take some time. Be patient with your progress. It may be beneficial to discuss with your manager the potential to limit the complexity level of your assignments for the first few months. This will give you time to be comfortable in your role prior to taking on the charge nurse role. Identify learning needs and activities and develop a plan to take on the charge nurse role. Reflect on activities as they occur. Formulate and document strategies to address your learning needs. Reflecting on your experience while preparing to take on the charge nurse role will be essential. You may find it helpful to use the Continuing Competence Program to guide your self-reflection. This is a good opportunity to review and reflect on the standards of practice and develop a learning plan to guide your ongoing progression and practice. As an independent practitioner, being responsible and proactive for yourself, your clients, and as a member of the healthcare team is part of your accountability. It is important to obtain a sense of these roles, responsibilities, and accountabilities expected of both a new graduate and of a charge nurse. To assist you in understanding and accepting accountability of the charge nurse role, look to trusted mentors for support, as well as reviewing any relevant literature. Asking questions is essential in any new learning environment. You may want to consider debriefing with a trusted, experienced colleague, nurse educator, or mentor about clinical situations you have encountered. To provide another avenue to educate yourself, you may want to consider discussing potential charge nurse scenarios. Gaining an understanding of leadership and decision-making in the charge nurse role is important for all new grads. If these strategies are unsuccessful, it may be helpful to review the Resolving Professional Practice Issues Guideline. This guideline consists of a 5-step process that will assist you in resolving a professional practice issue like this one and can be found on our website in the Professional Practice section under Practice Support Tools. There are restrictions related to the charge nurse role when holding a conditional license. New graduate, practical, and registered nurses with conditional licenses cannot assume the responsibilities of a care area, facility, or unit, and they cannot develop client assignments based on client acuity. For questions related to conditional license restrictions, you can speak with an NSCN registration consultant to help guide your practice and ensure your compliance with these restrictions. As well, you can visit the registration section of our website for additional information. To conclude this online module, we will end with some key points. Taking on the charge nurse role requires preparation that includes education, mentorship, orientation, and support. Your manager is your first contact to make in having these conversations as you begin working as a new grad. If you are asked to take on the charge nurse role and do not feel prepared, the strategies we discussed in the previous slides may be helpful. There are restrictions related to the charge nurse role when holding a conditional license. It is your responsibility to know what these are. If you have any questions related to these, please contact an NSCN registration consultant. Thank you for participating in this online education module. We encourage you to reach out to the practice team should you have any questions.